Hello and welcome to the Thrive Talk series sponsored by Thrive Counseling Center here in Oak Park. I'm Dr. Heidi Hammernick, a member of the Thrive Program Development Committee. And we at Thrive want to thank you for spending your evening with us as we continue our presentation series that has addressed mental health across the lifespan and specifically in relation to the pandemic. And we have previously focused on transitions in late adulthood, transitions with young adults and milestones. And tonight, we are excited to have Dr. Hillary Urban of Wildflower Center of Emotional Health in Chicago, whose presentation is titled, aptly enough, "These Times They Are A-Changin, Transitions in Adolescence." Dr. Urban is an expert in helping teens cope with numerous transitions they face. And as we all know, this pandemic thing has had more than its share of transitions. To give a brief rundown for tonight, Dr. Urban will be speaking until approximately 8:15, 8:20, after which there'll be a question and answer period. Please type in your questions in the chat feature at any time, and we will try to get to as many of the questions as we can at the end of the presentation. Now, before we get started tonight, I'd like to introduce you to Dr. Urban. She earned her Bachelor degree of Arts in Psychology from Michigan State University and her master's and doctoral degrees from the Chicago School of Professional Psychology. Her professional training took place in both inpatient and outpatient settings with individuals across the lifespan. Dr. Urban is passionate about working with adolescents and adults with a variety of presentations, including anxiety, mood disorders, personality disorders, psychosis, and trauma. Welcome, Dr. Urban. We're excited to have you.
Thank you so much for the lovely introduction, Heidi. So I am going to start out with sharing my screen today. There will be slides so everyone can follow along. So just give me a second to do that. All right, hopefully everybody can see that, but anyone, please let me know if you can't. Just a heads up, I cannot see you all either. So as Heidi said, please feel free to type any questions into the chat because I will not notice if you are speaking up or anything, as I can really just see myself and the presentation. So just a heads up. So as Heidi stated, the title of my presentation today is called "The Times They Are A-Changin, Transitions in Adolescence." So we will really be focusing on adolescence and what occurs during this developmental period, and focusing on some specific transitions that are characteristic to adolescence that I will be breaking down a little bit further and going into more depth on those. So to start out, I really wanted to just introduce adolescence and what it is. I think it's a very broad term, so I wanted to really define it so that everybody's on the same page and knows exactly what I'm referring to when I talk about this population. So throughout this presentation, we are going to be considering adolescents ages 13 to 18 years old. This is one of the most significant and transitional periods of human development. There's a lot of changes that occur during this time period, which can be both social, psychological, and physical. So we'll delve into those a little bit more today. So some of that development that takes place during adolescence. So as I said, there's definitely a lot of physical changes that occur. These physical changes are associated with puberty, which can often lead to individuals feeling self-conscious, or a lot of appearance comparisons can take place between adolescents and their peers, which can be really tough. Adolescence is also characterized by a need for increased desire for independence. So a lot of the times they're kind of people are finding themselves during adolescence wanting to gain more independence from their families. And as you can see on the next point, peers become a lot bigger of an emphasis. And there's an increased desire for peer approval as well. So a lot of the times you can see in teens that as this desire for independence increases, there can be a lot of like power struggles or pushing boundaries that I think we all kind of think of when we think of teenagers. In terms of the emphasis on peer relationships, this can also lead to more risky behaviors. So as peers become more prominent in their lives and individuals want more of that approval, they may engage in more risky behaviors that maybe they previously wouldn't have engaged in. But that desire to fit in or peer pressure can kind of push adolescents in that direction at times. We also have this idea of separating from parents and taking on more of an identity development. So as I said earlier, this is really a time period when adolescents try to figure out who they are, and what really they value and what they're looking to do in their lives and what's important to them. Along with this, there can be exploration of gender and sexual identity too. So along with trying to figure out who you are, this also includes sexual orientation and then an inner sense of their gender and whether this fits their assigned gender at birth. And then also a big thing is brain development. So during adolescence, our brains are still developing. The prefrontal cortex is actually one of the last parts of the brain to develop, which is super important because that's what's responsible for us being able to plan, make educated decisions, control impulses, which when you think about teenagers, at least kind of the stereotype that I have in my own head, it can be associated with poor decision making or very impulsive behaviors, difficulties planning ahead or organizing. And that's all because, well, it's partially at least related to this brain development and the prefrontal cortex being one of those last areas to develop. So now I want to talk a little bit about some of those stressors in adolescence. We all experience stressors, of course, but there's some that are unique to adolescence. I broke these down into different categories. So as you can see at the top, I put in major life circumstances. So these would be the really big things. So this would be like illness occurring, parents getting a divorce, any traumatic experiences, which when I say traumatic experiences, by that, it's kind of a wide variety of things. Something that I would consider traumatic, somebody else may not consider traumatic. So this is really this is very subjective and up to the person in terms of what they consider to be a traumatic experience. So this kind of is all encompassing to all of those things. We also have daily stressors. So these are going to be things just kind of on the regular that adolescents tend to struggle with. And a lot of these are kind of similar to adults too, just in terms of like conflicts in relationships or, school or having to make decisions related to the future. A lot of pressure is put on adolescents to make decisions at, I think, a very young age about what do they want to do for the rest of their lives? Where are they going to go to school? What are they going to study? And all of those things can add up and are very stressful for anybody, let alone teenagers as well, that are going through all these other changes. Because of these unique stressors that are associated with adolescence and the development that is still continuing, they're actually at risk for mental illness. They're at higher risk, at least, for mental illness. And we'll delve into some of these specific stressors a little bit later in the presentation, specifically related to transitioning to college is a big one. And then the COVID-19 pandemic, of course, as well. So I wanted to give a little bit of background just in terms of mental illness in adolescence. Like, what are we seeing? The research shows that up to 50% of mental health concerns begin before age 14. So up to 50% of people are experiencing these symptoms prior to or in the middle of adolescence, right? Or partially through. Overall, it seems like ADHD, anxiety, depression, and substance use disorders are the most prevalent among this population. And then poor adolescent mental health is associated with higher risk behaviors that sometimes persist throughout life. And by high risk behaviors, I really mean self-harming, so purposely hurting yourself through hitting, cutting, burning, anything like that, substance use, risky sexual behaviors, exposure to violence. All of these are at increased risk when an adolescent's mental health isn't doing so well. And these can pose challenges throughout the rest of their lives too. So another thing to keep in mind is often symptoms look different in teenagers than they do adults and children. So it's important to kind of keep in mind, how do these look different? So I kind of broke down the most common, as I discussed earlier, presentations that we see in adolescence and how they can manifest in teens. So among these, we have tearfulness, low motivation. Maybe there's a shift in terms of their motivation or willingness to do homework or even hang out with friends or engage in activities that they once found pleasurable. There can be sleep disturbances. So this includes difficulties falling asleep, staying asleep, sleeping more than usual, less than usual. There can also be physical problems. A lot of the time when adolescents come to me or other providers, I suppose, for help, they can be first complaining of some physical problems. And this can be like stomach aches or like chest pain or increased pain throughout the body. And that's can be very related to mental illness as well. And it's just manifesting in more of a physical way, or they have more words to explain the difficulty based on physical problems rather than from an emotional standpoint. That can be tough for some people. There can also be appetite disturbances. So this would be eating more than usual, less than usual, having an appetite and nothing sounds good. Also gaining or losing a bunch of weight or a significant amount of weight in a short period of time. We also have impulsivity as well. Self-harm, which, as I said earlier, can be purposely hurting yourself for a variety of reasons, through hitting, scratching, burning, cutting. Can also show up as impaired hygiene. So this would be just kind of noticing a decline in hygiene habits among adolescents. So maybe they're not showering quite as usual. Maybe they're not brushing their hair quite as much, or brushing their teeth has kind of declined. Anything like that can be considered impaired hygiene. We also have cognitive deficits that come with several mental health disorders. So this is the idea behind this, is that a lot of the times when people are struggling from like depression or anxiety, for example, we'll see that their processing speed, so they're not processing information as quickly, has declined. Maybe they have trouble staying attentive during classes, which never really used to be an issue. Any difficulties remembering information because they're not processing it to begin with, or their recall is poor. All of those can be symptoms of mental illness as well. We also have irritability. I think a lot of people think of depression as showing up primarily as sadness and very low mood. This can also show up as irritability. So this is definitely something to look out for. Increased conflict in relationships is a big one too. So if you're noticing that your teenager is not really wanting to hang out with friends, getting in fights a little bit more, whether with friends, with family, anybody that's really in their life, we often see that when they're struggling with mental health concerns. Declined academic performance is a big one, just because that is primarily what they're doing, right? Like when we think of teenagers, they're often in school. That can be a huge indicator. If all of a sudden their grades aren't doing as well, or they're struggling to complete their homework or have the motivation to, looking at that academic performance is a great way to try to figure out if something is going on. There's also isolation that shows up. So if typically they are very social, wanting to hang out with friends a lot, or spending a lot of time in the family room or like common areas of the house, Sometimes they will retreat and want to spend more time in their room or not want to hang out with friends quite as much. And then, of course, we have suicidal ideation. So any thoughts about wanting to hurt or kill yourself as well. So these are all different ways that symptoms can manifest in teens. Obviously, this is not a full encompassing list, but these are kind of what shows up quite a bit from my experience working with adolescents. Okay, so in terms of the COVID-19 pandemic in adolescence, what are we seeing? So before I go into this section, I want to give a caveat that obviously we are still in the pandemic, hopefully not for much longer. And these stressors are still very present and still being studied. So the research is still ongoing in terms of what I'll talk about in terms of the pandemic. But what we are seeing, which I think a lot of these relate to adults as well, is just increased isolation, not as much structure with not going to school and being home and doing Zoom schooling, increased social media use because there's not as much to do. Teens are also relying on social media for news more so than reputable news sources, which can create some problems in terms of is the news that they're getting even accurate? This could cause increased anxiety if it's not accurate and it's portraying things in a way that isn't quite as it is. There's also a new learning modality. So most people have had to transition and figure out, how am I going to learn on the internet? It comes with a lot of different variables just in terms of working the technology, not having that social interaction at school, like having to sustain your attention on your own without the redirection from teachers often. This can be really tough for a lot of people. Then we've also seen a decreased involvement in extracurricular activities. So obviously, along with school being suspended, so were any extracurricular activities, which is a big stress reliever for a lot of adolescents. So that can be tough. Okay, so continuing here, we also have concerns about worrying about family members. Adolescents have older individuals in their lives that they may be worrying about. They're less physically active, which is tough and often a big stress reliever for adolescents. There may also be hesitation to receive in-person higher levels of care. So by this, I mean, maybe they were struggling with mental health concerns and engaged in treatment prior to the pandemic hitting, and now are struggling a little bit more, but there's hesitation to maybe take your therapist's recommendation to go to a higher level of care, such as intensive outpatient programs, partial hospitalization programs, or even inpatient for more severe presentations. There's also a lot of boredom, understandably, less privacy. Everybody's kind of living on top of each other. Maybe they aren't even having their own room. And then decreased freedom as well. Okay, there we go. So what the research shows so far is that the COVID-19 pandemic has increased adolescents' risk for anxiety, depression, PTSD, irritability. There's been higher rates of domestic violence in the home as well, and child abuse, which kind of goes along with the next two, which is tension and family conflict. So as I said, this research is still being conducted because we are still in the pandemic, but this is kind of what it's showing so far. Okay, I think a big thing that we all need to kind of consider is hopefully we're moving out of this pandemic soon. And with that comes new stressors. I think when we went into this pandemic, I mean, at least for me, it was like a major shift. Like, oh my gosh, this is messing up my routine of going to work every day and having that consistent schedule. And now everything's kind of turned upside down and you have to adjust to being home all the time. Well, now we're about to come across that again as we transition out of the pandemic. So for teens, this really means returning to school and in-person classes, increased socialization, not only at school, but also friends asking them to hang out outside of school as they get a little bit more comfortable with the restrictions are lifted and socialization is more acceptable now. There's also a significant change in their routine. So this would be, we had our routine of going to school or going to work every day and having that consistent schedule, got used to being at home, created a new routine, and now that's kind of jumbled up again. And that routine has to start over and figure out what that will look like again post-pandemic. We also have a shift in the learning modality again. So a lot of people got used to learning remotely and doing the Zoom schooling, and now it's back to in person, which is an abrupt change. And then there may also be concerns about getting sick as we transition out of the pandemic. Before I created this, the vaccine wasn't approved for 12 and up, but now it is. So that's helpful with this. But there may still be concerns about getting sick and developing COVID-19. So what are signs that we should seek help, right? So if you're seeing these things in your adolescent, you're having some concerns, like how do you know if they need professional support? One way that I like to think about it is ongoing versus fleeting difficulties. And by this, I mean, okay, are these struggles continuous? Have these been going on for a couple weeks? Or does it seem like, and consistently, or does it seem like these difficulties kind of come and go? If they're more ongoing, that is more of an indicator that they're struggling. And that would be a good way to know, okay, maybe we need a little bit of additional support. Also, a good guideline is impairment in functioning. So this is all about considering how are they doing at school? How are they doing at home? In their relationships? Are things shifting a little bit? I know earlier in the presentation, I was talking about like, okay, if your teen generally likes to socialize a lot and now they're isolating a lot, like comparing their behavior now to their baseline behavior that you've known them to have throughout their lives up until this point. And considering it in all these areas of functioning in terms of, are they getting their home responsibilities done? Are they completing their homework? Are their grades slipping? Like, are their relationships kind of declining? Is there a lot of conflict in them? So a big one as well is suicidal ideation or self-harming behaviors. So if your teen comes to you and expresses having urges to hurt themselves, or is actively engaging in hurting themselves, or is having thoughts about killing themselves, that is a big one. 100% seek support if that is the case. And then at the bottom here, I have if you are concerned. And basically, parents should trust their gut, right? Like, you know, your adolescents, you know their baseline behavior. So if you feel like something is off, there's a chance there could be something that's off or something that's going on. So really trust your gut if anything is like pulling those red flags for you. And I want to highlight as well that the symptoms don't need to be super severe to seek help. So while I have suicidal ideation and self-harm on here as indicators to seek help, it doesn't need to get to that point at all. There is nothing wrong with coming in for a consultation, doing an intake, saying, hey, I don't know, they could be fine. And just having a professional get their eyes on them and assessing. We do that all the time, and that's totally acceptable if you have any concerns coming up. So how can parents help? So what can parents do? I think number one is really anticipating that for a lot of people, it could be anxiety provoking to return to that new normal. I think a lot of people may be excited. A lot of people may be nervous. A lot of people may have a mixture of emotions in that way. And that's okay, because there's so much uncertainty related to this process and what it's going to look like, because none of us have ever had to transition out of a pandemic before. So anticipate this may be tough, and that's okay. Next, I wanted to really highlight empathizing and validating. So I think a lot of the times people can jump into kind of problem solving mode or fix it mode. And I think sometimes just providing a listening ear and saying, yeah, that is really hard, or sharing your own experience in that it's difficult for you as well, or for the parent as well, can be so validating, and show them that it's okay to be struggling and it is scary, and not necessarily try to fix it for your teenager, but just kind of hear them out. Some things just can't be fixed, and that's okay. Empathizing and validating goes a long way. So next we have being consistent. So the idea behind this is really trying to maintain consistency in terms of rules in the household, expectations you have of your teenagers, kind of things like that. This consistency can really help ease some of that uncertainty that's associated with the process of returning back. So like I said earlier, there's so many unknowns related to this transitioning process. So having as much consistency or routine in other areas of your life can be kind of that rock and that foundation to be like, okay, well, this is going, I know what to expect here. That can help them deal with the unexpectedness of returning after the pandemic. And then I have on here initiating open conversations about concerns. So really just kind of making a space to talk about those concerns and initiating those conversations, because a lot of teenagers don't want to initiate those conversations, or aren't comfortable, or aren't even knowing how they're feeling. So as parents, creating that space and just allowing them to talk about any concerns shows that you care, shows your support for them. And it creates that opportunity, even if they're not willing or interested in talking about it. So additional ways that parents can help is practicing flexibility. So by this, I mean trying to meet them where they're at and acknowledge that there's no right way to handle the transition. So some people may find certain things supportive. Other people may find that the least supportive thing ever. So trying to be mindful of that, like what works for you may not work for your teenager, and that's okay. So try to practice that flexibility and ask them, like, what do you need? What would you find supportive? And try to provide that to them if that's reasonable. So setting small goals. So this is kind of like easing your teenager back into normal life, is what I kind of meant by this. So for example, if they are worried about socializing with a big group of people, maybe easing into that instead of going right into the deep end, saying, okay, well, maybe you'll hang out with your best friend for like an hour and maybe it'll be outside, or making those accommodations so that they feel as comfortable as possible and feel like they're not thrown into the deep end, and can kind of do it slowly at their own pace that they're comfortable with. I said this a little bit earlier, but again, trying to maintain some type of routine and structure. So it can be super hard to adjust to the busyness after isolation. So keeping as much routine as you can to try to ease some of that overwhelmingness and provide that consistency. So some examples of this would be maintaining a regular sleep and eating schedule as much as possible, or carving out time for breaks or alone time if they're nervous about the socialization and just being busy with others. So another transition that I wanted to talk about today is the transition to college. So obviously this is a big one for adolescents. As I said earlier, this is really a time that's characterized by trying to figure out, what do I want to do with my life? What is my next step after high school? So I wanted to speak of this a little bit. So the research shows that 60% of individuals begin college the year following high school, and a majority move away from home into university or private housing when they start this transition to college. Overall, first-year students have reported consistently high stress throughout that first semester of college as well. And then I also wanted to speak about the COVID-19 pandemic and how this has affected college admissions and transition. Transition to college looked a little weird this year. It's very different, and it's changed that admissions process as well. And to be honest with you, this could be its own presentation in itself. But for example, the COVID-19 pandemic has made it more difficult to tour colleges. Maybe people are doing more of the Zoom tours, which makes it tough to pick a college if you're not going in person. Or the tours are a little bit smaller, or they're adjusted based on the pandemic protocols. There's also more financial stressors, as parents may have had job changes. Private schools are also concerned about sustaining themselves. So there's financial stressors on both parties there. There's also been a lot of changes in standardized testing requirements. So as tests haven't been able to be held and have been canceled, a lot of universities have been dropping these standardized test requirements, which I think has been kind of nice. And I'm sure the adolescents transitioning to college right now feel the same way. But that's been a major change, as that's a huge stressor for a lot of adolescents as they're preparing for college. There's also been changes in enrollment deadlines, so things have been a little more flexible that way. And then some questions about the value of remote college learning has come up. So is it worth it to go to school right now if learning is going to be completely remote? Or is the education not worth it right now, and maybe putting it on pause until in-person classes can be held would be a better decision? Okay, so with the college transition, the research shows that there's increased rates of anxiety, depression, substance abuse, and suicidality. And the research shows that among college students in the United States, suicide is actually the second leading cause of death. And this is behind accidental injuries. So these are very real struggles that a lot of college students are experiencing throughout this transition. Contributing factors. So I really wanted to speak to why are we seeing this relationship? As people transition to college, why are we seeing this increase in anxiety, depression, etc.? So part of this, the research suggests, is because there's increased recognition and more effective treatment in childhood and adolescence. So this is basically speaking to mental health is becoming more accepted these days. People are receiving treatment earlier. They're seeking out services earlier. So these presentations are seen more, and the numbers are rising because people are seeking services. So this could be a reason that we're seeing that increase, is because they're getting those diagnoses. There's also a role of the risky behaviors I spoke to earlier in making adolescents a little bit more vulnerable to emotional health concerns. So by this, in terms of risky behaviors, this includes substance use, getting off normal eating schedules and having abnormal eating patterns, sexual activity, absenteeism from school or classes, not submitting assignments on time, and 100% poor sleep habits or patterns. And then the new stressors associated with transitioning to college as well. There are unique stressors associated with this that all kind of raise our vulnerability to mental health concerns. So some of these stressors include limited direct supervision of behavior. So adolescents are moving away from home, as we suggested earlier. When they go to college, a lot of the times, parents aren't there to supervise their behavior. Their personal time isn't being monitored as much anymore. Accountability at school also isn't being monitored as much. There's increased opportunities to engage in risky behaviors. So with this limited direct supervision, we also have an ability to engage in more of these behaviors, which we know are more common among teenagers as they desire this independence and peer approval a little bit more as they make this transition. Moving away from home and new living arrangements can be a huge stressor. So feeling kind of homesick, it can be tough to move away and leave your family and move in with roommates. Those are really difficult relationships to navigate. that they may never had to deal with prior to moving to college or making this transition to school. A change in social support. So sometimes friends don't go to the same school. So there's a major shift and there's a loss in leaving old friends behind or at home. And then making new friends at school, which can be stressful in itself without the change already occurring. There's an increase in adult related responsibilities. So this would be like household responsibilities, doing laundry, managing money, getting groceries. All of those things are amped up as kids move into college and away from home, which adds additional stress, of course. Self-management of physical and mental health. So this is basically taking ownership over attending doctor's appointments, maintaining prescription refills, and being consistent with whatever is needed to protect and treat physical and mental health concerns. Mom and dad aren't there anymore to hold teenagers accountable for getting their dentist checkup every 6 months. And then, as I mentioned earlier, in terms of transitioning out of the pandemic, with transitioning to college, there's also some adjustment to new methods of learning. So I went to Michigan State University for undergrad, and I had some lectures of 300 people, which was very different than a class of 20 people, all in a classroom where I knew everybody. So adjusting to that difference is huge as well. So what can parents do? How can parents support their adolescents as they transition into college? So first I have here tuning into their needs when they present problems. So this is very similar to what I was saying earlier in terms of not automatically jumping into that problem solving mode. When they might actually be looking for somebody to just vent to, or somebody that'll listen to them and validate their struggles and say, yeah, that sucks, it's hard. So tuning into what they need. Allow them to guide some of the contact expectations. So I think a lot of the times when adolescents go to college, the parents have an urge to dictate, like, okay, you need to call me every day to check in so I know you're safe, because this is tough on parents too. And I think it's important to allow them to have some independence and some say in terms of those contact expectations. Having open discussions about what excites them and makes them nervous about transitioning to college. This can be tough, and there's a lot of mixed emotions associated with it in terms of maybe they are super pumped and they can't wait to go. And there's probably components that they're a little bit nervous about. So again, creating that safe space and the opportunity to have those conversations, whether they take you up on it or not, it shows support and it shows that you're willing to be there to support them in that. And then allowing some independence in managing stressors. So I think it can be very easy to come to an adolescent's rescue when you see that they're struggling because they're your child and you care about them. But it's important to not overparent or be like a helicopter parent, because in a way that indirectly communicates to them that they can't handle these challenges on their own. And it's about allowing them to kind of learn some things for themselves and show your support for them, but don't necessarily run to their rescue, and allow them to try to problem solve and figure things out to an extent before you come and save the day, so to speak. So just a continuation of tips for parents supporting this transition to college. I think encouraging them to utilize university resources is huge. As I said earlier, mental health is being recognized a little bit more as time progresses, which is great because colleges and universities have been trying to adjust the services that they're providing and create more of a space for that within the university community. So encouraging them to look into, okay, what are your options in terms of getting counseling, even through the university, or what are some groups that you might find supportive. Discussing expectations or agreements in advance. So the idea behind this is having a discussion about, okay, what are these expectations that I have for you, that the parents have for the child in terms of grades? Will they be working? Are they expected to financially support themselves independently, or will there be financial support from the parents? What are those really things that you both need to be on the same page on? This can really avoid arguments as they begin this stressor, this transition, as the expectations and agreements are discussed in advance. They know what to expect. So that can relieve some uncertainty related to that stressor. Encouraging balance between school and extracurriculars is also a big one. I think it's important to really, while school is obviously important, extracurriculars are a way that they are able to let off some stress, and letting off some stress and engaging in activities they enjoy sets them up to manage future stressors more effectively. So making sure that there is a balance between this in terms of not being all school oriented, and also not being all extracurriculars oriented. There's definitely a fine balance between the two. And then developing a plan together to manage pre-existing symptoms. So this would be if you know that your adolescent already struggles with anxiety and is engaging in therapy at home and taking medication, what are they going to do when they get to college? Have that set up and have that plan already developed together. So that's one less thing that they need to figure out so that they can continue that support. Because pre-existing presentations, if you already have pre-existing presentations, that's going to increase the likelihood that you're going to struggle if that treatment reduces, especially during a time of transitions like this. Okay, I think that's it. All right, so perfect timing. Now we have come up to the questions portion of the talk today.
Great. Hillary, thank you so much. What an excellent presentation. Covered so much that I know that this is such an important time for people and with all the changes. So I had a couple questions, and I think you covered this a little bit in your talk already, but maybe to review it a little bit for people. So with all the symptoms that kids may exhibit during this time, how do you know what are normal variants and when to intervene?
Sure. Yeah. And this is a major question that comes up a lot, I think, with parents. And like I said earlier, I think it's really knowing your child. So you know their baseline, you know what they're typically like. How is this comparing to that? And obviously, like as different stressors come up, like those are going to change to an extent. And are you seeing that they're coping effectively? Are you feeling like this is impacting their functioning in terms of being able to do their schoolwork? Is it impacting your relationship with them? Are they just a little bit snippier and there's more conflict and things like that? So really trying to reflect on their previous, oh man, it's like changing.
Yeah.
Sorry, that threw me off. So really trying to reflect on what is normal for this person and how much is it impacting their functioning in all those areas.
Right. And I like that idea too of how you said there's that baseline, you know, what was it compared before all of this happened? Another question we had was, are there statistics around suicidal ideation? And specifically this came up during high schoolers.
There are statistics. I do not know them.
And actually, so I'm just popping in to kind of join Hillary for this part. I'm Eden. I our director of education at Wildflower. Hillary, I knew you knew this and probably didn't have the statistics.
Nope.
So I looked it up real quick.
And
I can just speak a little bit to there are statistics that show ideation increased, and the American Academy of Pediatrics showed that in the spring, summer of 2020, they were up, like ideation reports for adolescents were up 1.4 to 1.6 times higher. Going into the pandemic and kind of in the midst of that, there was a real sense of crisis and urgency that would also equate to increased completion of teen suicide. And let's look for the kind of the bright spots where we can here. That did not prove to be true. So while there's a greater sense of urgency in maybe the mental health crisis and the sense of helplessness and despair, there didn't prove to be the increased completion that was expected during the pandemic. Now, of course, we balance all of that out with the statistics that there is a really disturbing trend upwards with teen suicide that's been predating before the pandemic.
Gotcha.
Yeah.
Another question was, everyone's been struggling a lot, and how do you find someone to help out, a therapist, when appointments are 3 to 6 months out?
Oh, I hate that. It's so
Yeah.
frustrating. I think that I use Psychology Today a lot. I think that is an awesome resource. Looking up Psychology Today, you can put in your insurance and your presenting problem and where you live and stuff, and a bunch of providers will pop up. It usually says if they're accepting new patients or not at that time, which may or may not be accurate. You'll obviously have to call to confirm. Yeah, you can do that. Calling the number on the back of your insurance card, they'll let you know who is in your network in terms of that. Again, those providers may or may not be accepting new patients, but at least you'll get a pretty substantial list a lot of the time in terms of options.
Great. And go ahead. Sorry.
Well, I was just going to add, like, Wildflower, many group practices will be able to do an assessment at least, and then either tell you how long the wait list would be or provide referrals if it's longer than is what feels appropriate. And if it's a crisis, if it's more than just what could be treated in outpatient level of care, like a higher level of care, IOP, PH, and intensive outpatient programming, partial hospitalization programming, so many acronyms, or the need for inpatient hospitalization, there should not be a wait list for assessment or admission.
Great. Also, tell me a little bit, had some questions about, and one I had also was, what do you think the pandemic has taught our kids, and in terms of their resiliency and what they're able to do?
Yeah, I've been so impressed with how so many of my adolescent clients have been able to adjust. And I think it's taught them, as you said, that they are really resilient. And while this probably seemed very impossible when the pandemic first started, they got through it. And I think like focusing on that and reminding them of that is huge, because this is really hard. And maybe they are a little bit more independent than they initially thought, and they're not relying on their friends as much as they thought, which I think is awesome and can be very empowering.
Right. Excellent. We have one here that says, what's the best way to respond when adolescents roll their eyes at adults and seemingly blow them off? Can you give me some language to help respond to the eye roll?
Yeah. I try to like cushion it with some empathy. So I have adolescents do that to me all the time as well. And I'll be like, I know this is annoying and I have to ask and I want to provide you support. So as annoying as it is, like, please just let me know if you need anything from me or whatever the conversation is. But I find that validation and like just speaking to that eye roll in an empathic way can be helpful.
Great. Right. And I know some families have also had, the transitions have transitions. So for example, and I'm sure this may continue into the fall, that kids are back in class, somebody gets diagnosed, everybody's got to come back home and be on quarantine, and then they got to go back, and this puts a stress and strain on the family because maybe they just transitioned out from having daycare, but now they got to go back to it. Yeah. Do you have anything for these meta transitions that parents and kids are going through, and with the systems that, they don't have any control over?
Yeah. Yeah. And I think a lot of the things that I talked about in the presentation can be applied beyond just transitioning out of the COVID pandemic, to be honest with you. and out of the, in terms of like transitioning to college. Like there were some repetitions there in terms of trying to provide that structure, creating a safe space to talk to them about it, letting them know their resources in terms of what their options are to get support. So I think a lot of them can apply to that as well. And just, again, I keep saying this, but that validation, that empathy can go a mile, and just listening rather than trying to problem solve, and trying to practice some flexibility, that people are going to transition in different ways. It's going to look different for different people, and that's okay. So trying to allow them the space to figure out what works for them too.
So that understanding, that, like you said, that validation, and a place to talk, not moving right into fix it mode per se.
Yeah.
Another question I had here: what are some tangible coping skills parents can use with their teens struggling with anger?
Okay. I love coping skills. So one of my favorite coping skills, when people are very emotionally dysregulated or feeling intense emotions and are kind of very hot-headed, whether it's anger, anxiety, any intense emotion, is tip. So the idea behind this is to use a coping skill that doesn't require a lot of thinking. These are very behavioral, because when we're in that headspace, we often can't think straight, let alone come up with a way to deal with it. So TIP stands for temperature change. So this is, for example, splashing cold water on your face, or holding an ice cube, or sometimes I'll have my adolescents bring frozen water bottles to school, because then they can just hold it and no one really knows what they're doing anyway. So it's perfect. And the idea behind that is to shock your system. So a lot of the times when we're super angry, we're super emotionally elevated, we'll experience increased heart rate, difficulties breathing, we'll get warm. And this counteracts a lot of those physiological responses that occur when that emotional response happens. So that breaks up that cycle. The I is intense exercise. So the idea behind that is doing an intense exercise to get your heart rate up for about 10, 20 minutes. And same thing in terms of the physiological responses we often experience, like increased heart rate, difficulties breathing, warmness, sweaty, shakiness. A lot of those same things happen when we're working out or getting an intense exercise in. So it really kind of tricks your brain, honestly, into thinking that you're feeling that way physically because of the exercise, and not because of the anger or the anxiety or the intense emotion. And it can break up that cycle for you too. Because a lot of the times when we notice that, it like makes us more angry or more anxious. So it kind of tricks your brain that way. And then the P is progressive muscle relaxation. So the idea behind this is to tighten or flex different muscle groups in your body. I do my fist just because that's the easiest. Hold it for about 10 seconds and then let it go, and notice the difference between the tension versus the relaxation. And you can go through your whole body. Like I hold a lot of stress in my jaw, so I'll go like this and then let it go, or in my shoulders, and going through your whole body. And this activates your parasympathetic nervous system, which is basically our relaxation mode, and counteracts that fight or flight mode, or the sympathetic nervous system, that is often activated when we're feeling emotionally dysregulated.
Great.
And then the last part is paced breathing. So
two P's.
Yes. Right. Paced breathing is about breathing in through your nose, out through your mouth, and just making sure that your exhale is longer than your inhale. So if you're inhaling for 5 seconds, exhale for like 7 or 8, whatever feels good. And this works the same way as the progressive muscle relaxation, in that it activates the parasympathetic nervous system.
Great. Fantastic. So let's see. This came in through the Q&A. So if a teen has called the suicide line before to talk, and because of concerns, the police arrived and was placed in an inpatient program. While he's been going to therapy and things seem good, is there another safe place for them to reach out if they feel they need to talk?
Would this be, do you mean, I guess you didn't ask the question,
yeah,
but
like,
like during treatment, or like if there's an emergency and it feels like a crisis situation and they're
It's-
not seeing somebody yet? Or...
I think, no, it's just, it seems like a general place to talk. We're not sure who it came from, but so he has been going to therapy and things are okay. Is there another safe place for them to reach out if they need to talk? So my guess, the way I see that is that, what if the therapist isn't available?
Sure.
Things like that. What could they do? Where's a safe place if they need it beyond the what they're already getting?
Uh-huh. Eden, did you
Well,
open?
there are a couple of warm lines. There's one really specific one I'm thinking of, which is it's a gender and queer mental health, mental crisis warm line that's specific for that population, that actually guarantees that the intervention will not include calling the police. It's a really, really good question, because you do need to understand that reaching out for help in crisis could lead to being escalated in that way. That being said, it's still encouraged using the National Suicide Hotline if you're experiencing suicidal thoughts. And more often than not, it's a place to talk and to process and to stay safe. And for this particular situation, I would hope that once they're paired with a therapist, they've either been in a program, that could be something to create some sort of like cope ahead plan or strategy, so that they would know like how to cope with those crises, who are the safe people to turn to, when their therapist would be available, and what else would be an option in crisis.
Great. And I'm going to take one more question here, and then I'm going to turn it over. This is not, this may require a little more thought, but how do you help support teens who are 18 and older and resistant to treatment?
Ugh,
No, it's not a simple answer, but if you could give some general guidelines.
mm-hmm. Yeah, that's a hard one, because they're 18 and they can call their own shot at that point. I think that having those open conversations, like, hey, I've noticed A, B, C, D has changed. Like, are you doing okay? Is there anything I can do to help you? Like, I think you might benefit from treatment with this person. Like, please humor me and just go to an assessment. I do find that I worked in a higher level of care before, and a lot of the times parents could get their teens in just for an assessment, and just kind of getting their foot in the door can be helpful. And then they hear more about the program and stuff and are sometimes a little bit more willing. A lot of the times in those assessments, I would say, hey, let's try it for a week and see how it goes. So kind of trying to ease them in that way. A lot of teens have been receptive to that, at least in my experience. But if you have, oh, sorry.
No, go ahead. You were finishing.
I mean, if you have concerns about their safety, though, like, it is important to get some support and have them evaluated, because safety is obviously our number one priority. And if you have concerns that they may hurt themselves or anything, it's important. I mean, it's not ideal, but there's always options to get them some treatment, even if they aren't willing, if their safety's at risk.
Great. Well, thank you again, Dr. Urban and Dr. Eden, for your enlightening presentation, very timely, and for taking the time to educate us and support our community here. Okay, I'm going to now turn it over to John Meister, who has a few comments. He is the CEO of Thrive. Take it away, John.
Thanks, Heidi. First, I want to thank Dr. Urban and Wildflower for a terrific presentation and a great collaboration with Thrive. Thank you so much. And thank you, Heidi, for doing a great job. Heidi is a former board member, and we hope to have her back on the Thrive board soon. So there are two things I want to ask. There's a survey in the chat, and so we would really appreciate you telling us what you think. This was the last of our Thrive Talk series for this spring, and we're going to begin preparing for a fall series and another spring series, but we need your help. We need to know what you're interested in. We need to know what you would like us to be presenting. And so it'd be a great favor to us if you could fill out the survey and tell us a little bit more about what we should be presenting to you. The last thing I'm going to do is ask you to recognize that this program, as well as many other programs at Thrive, are not fully funded. And so we really count on people like you to help support these programs. And so if you enjoyed today's presentation, or even if you didn't enjoy it, but you've enjoyed other ones, please, if you can, donate to Thrive. We really need your help. So again, thank you so much, Dr. Urban. Wonderful presentation. Thank you so much for ending our spring series. And thank you again, Heidi. And thank you everyone for who attended tonight's presentation. We appreciate your attendance and we look forward to seeing you again.
All right, thank you.
Thank you, everyone.